Welcome to AAKP's annual meeting and to this session of Under the Dome. This is the 5th year that the American Association of Kidney Patients has had this session Under the Dome, named out of respect to the United States Congress and much of the activity that happens in kidney policy. During this session, and over the past 5 years, we've featured some of the top folks that are involved in kidney policy and advocacy, both on Capitol Hill and at the other end of Pennsylvania Avenue in the White House and in the executive branch. We've had top guns from the American Society of Nephrology, the National Kidney Foundation, the American Society of Transplant Surgeons, the Renal Physicians Association, the American Society of Transplantation, and many other organizations pay in our Under the Dome sessions. And why do we do this? Pretty simple. Because as much as we would like for things to happen in Washington, D.C., the fact is that it can't happen from patients alone. It takes the entire kidney community. And what it also takes is an understanding of the policy issues and dynamics in the Congress and in the White House under successive administrations. And the only way to build that understanding and that expertise is to keep doing over time the introduction of the issues, the concerns, the terrain that actually shape kidney policy, and to make certain that patients and patient advocates understand the concerns of our allies that we work with in order to achieve victories. Because a victory in kidney policy from the perspective of patients sometimes might be different than that for professionals, but the most important thing is that we're working together. For our session today, we have two top guns, two good friends, and as you'll see, two serious experts on kidney policy who have years and decades of expertise, and they have helped out kidney patients across America throughout their entire professional career. Our first speaker is Rob Blaser. Rob Blaser is the Chief Federal Affairs honcho for the Renal Physicians Association. And although we kid around a lot, Rob brings with him great expertise from private sector insurance and from nearly 25 years of work with the Renal Physicians Association on key issues of legislation, and most importantly, the important role that regulations and payment decisions have for innovation in how kidney medicine is conducted in the United States. Rob is a recipient of the AAKP President's Medal, and we have a fantastic ongoing relationship with the Renal Physicians Association. We view them as frontline doctors, and Rob has been the interface for their concerns, the concerns of patients, and the coordination with our organizations. Together with the Executive Director, Dale Singer, they are a powerful team in Washington, D.C., and one that we have great trust in and great rapport. Our second speaker, following Rob, will be Peggy Tighe. And Peggy has tremendous expertise as well. She represents the American Society of Transplant Surgeons, or ASTS. She, along with Bill Applegate, who represents the American Society of Transplantation, cover the waterfront on transplantation issues, and we work extensively with them, not only on patient concerns, but also on the concerns of transplant centers and transplant professionals. Peggy has a very distinguished background in Washington, D.C. She has worked on both sides of Capitol Hill, on the Senate side and on the House side. She is one of the most respected and actually one of the most awarded lobbyists in the healthcare space. She was instrumental back in the late 1990s on the important piece of legislation known as the Patient Bill of Rights. In fact, Peggy's efforts were able to get 3 senators to change their positions and to join to gain passage of the Patient Bill of Rights. I first came to know Peggy in her representation of hospitals during the rebuilding of the hospital and healthcare system in New Orleans after Hurricane Katrina. She was known by her reputation as being tough, honest, and direct, and insistent that a healthcare delivery system be stood up immediately for the people that had suffered through Katrina. She brings that same community and patient focus to kidney issues, and we have worked extensively with her over the past 10 years. She has great humor and great insight on what actually it takes to be successful. And so today you have Rob Blaser, you have Peggy Tighe, and we hope that you enjoy this session and are able to use the skills and knowledge that are conveyed by both Rob and Peggy throughout the year to increase your effectiveness alongside AAKP in our efforts to get principled policy passed through the Congress and implemented by the White House and the executive branch. So without further ado, let me go ahead and move to my friend, Rob Blaser. Hey, Rob, thank you so much for joining us again for Under the Dome. This is your fifth year, and we appreciate it. One of the things that's been interesting over the past 18 months, Rob, and you and I have talked about this, is the number of new patients AAKP has been able to engage, partly because of COVID and the fact that we're operating in a virtual environment. So today at our annual meeting, we have a lot more patients that are engaging with us and learning the public policy process and wanting to be involved on virtual Capitol Hill days. And I thought it might be a good opportunity for you to kind of lay out what makes a successful coalition effort on legislation from your perspective, given all of your expertise on Capitol Hill.
Well, first, Paul, thanks for the invitation. Love to be here. Love AAKP, so I really appreciate being able to be a part of the community here. But with regard to your question on coalitions, I would say it's open partnerships and cooperation. You know, something I've learned from you, Paul, a phrase you put in emails to me about half a dozen times a year is no surprises among friends. We communicate. You know, AAKP and RPA aren't always going to have the exact same position, but as long as we're open with each other and there are no surprises among friends, that really, I think, contributes to having a coordinated Capitol Hill Day. And I think that applies both on broader policy issues and then on specific advocacy activities, so at both the macro and micro levels. So, you know, there's no surprises among our organizations on policy positions, and there's no surprises during, say, a Capitol Hill visit when a physician and a patient will be going up to the hills. As long as they've coordinated their message, that should be what happens. How's that sound, Paul?
That sounds perfect, actually. And that is actually how we've operated for a very long time. And so that folks understand this, I think there are a lot of things that are said and unsaid in Washington, and we understand how that works. But for somebody who's new to this, can you also give us an example or illustrate what the lack of success and what a unsuccessful coalition effort looks like, so people understand the two bookends of the process here?
Sure, and not to leap to the easy, but I would say it's kind of the inverse of what we spoke about no surprises among friends. And I guess that would be, say, you know, contradiction broadly or contradiction in the moment. You know, if our organizations are being open about our disagreements to the Hill in kind of a disparaging way, well, the advocacy effort is probably going to go down the tubes, you know, the broad advocacy effort. And then in the moment, in a Hill meeting, it's the same situation. You know, if the patient and the physician are contradicting each other, I don't think they're going to get their message across. And, you know, for what it's worth, if congressional staff catch a whiff of disagreement within the community on a bill or a lobbying issue or during a Hill visit, it gives them an excuse not to act. So you really want to have a coordinated message so that doesn't occur.
Yeah, and I appreciate it, Rob, because over the past 10 years, I can't think of one instance where we've actually had any type of open public disagreement, and the communications back and forth has always been terrific. But for those who are watching, this is essentially how our organizations collaborate and work together. The other thing that we collaborate and work together on and have a shared understanding is, I think there's a perception sometimes that all of the action in Washington that impacts doctors and patients happens only in the Congress. And one of the reasons why we've been able to work so well with the Renal Physicians Association is because Rob is a master at both ends of Pennsylvania Avenue, not just the Capitol, but also the executive branch, the White House, and the agencies that come underneath that, like the CMS and CMMI. And I was thinking, Rob, it might be helpful for folks to understand the power of CMS in kidney policy. And you are probably one of the most experienced in that regard in terms of how things are paid for and how things are deliberated at that agency. Can you elaborate on that?
Sure. You know, I mean, the baseline is that Congress passes laws and the executive branch implements them. So how the law is framed and how much leeway the Hill gives to the executive branch or HHS or CMS or whoever is really huge. So there are going to be times where Congress is going to get kind of micro, generally not a great thing for the most part, but they might say, we want the payment rate to be at 5.2% or something like that. And then other times they'll just say the secretary shall determine. Paul, I'm going to get this number wrong, but you've probably heard the whole story about the number of times that phrase occurred in the Affordable Care Act or Obamacare. I think the phrase "the secretary shall determine" or "the secretary shall develop," something like that, was in the Affordable Care Act something like 1,500 times or something like that. So that gives you an idea of Congress giving the Secretary of HHS the leeway to make the decision. So it really depends on how it's framed, but the broader lesson remains: Congress writes laws, the executive branch implements them. I think some people would say the executive branch is more important because that's kind of like and not to go 20th century here, but that's like the stylus needle hitting the record. You know what I mean? That's where it happens. And there's plenty of times where the executive branch will do something and Congress will say, well, that's not what we meant. And they pass another law to undo what CMS did. But that's kind of the breakdown. Does that answer your question? I don't know if I'm getting to what you wanted to.
Yeah, no. Actually, it hits the question right on the head. And that's one of the reasons why we like working with you so much, is because of your expertise in issues on implementation is just as steep as it is on the legislative process. And that's why at AAKP, Richard Knight, he comes off of Capitol Hill. Ed Hickey comes out of the executive branch. I come out of the executive branch. And that blend of both sides of Pennsylvania Avenue is important. And then your expertise on the actual implementation regs. For much of kidney policy, the issue of payment and reimbursement is central to innovation and care choice for patients. And so one of the issues here that has come up on the Hill this year is telemedicine. But before we get into that issue, I wanted to get your insights on what exactly is the terrain right now on Capitol Hill. What's the vibe? What's the feel? So as we're asking patients to engage, they have a better understanding of all the other things that are in front of congressional staff and just the environment for trying to get a consensus on things. You always have a very good and candid intake on that, Rob, because your ear is to the ground all the time.
Thank you, Paul. And before I answer the question, I just want to say one of the things that AAKP and RPA have in common is I think we punch above our weight. The expertise you all have on Hill and executive branch stuff always never ceases to amaze me relative to we're both kind of small organizations. I just have so much respect for what you all do. So just want to put that out there. But anyway, in terms of what's going on right now, in the last few years, people have been saying unprecedented. We're in unprecedented times, and it becomes a cliche, but just the same, I think it's kind of apt here. They're trying to increase the debt ceiling, which is the government borrowing power, the government's credit card limit, so to speak. They're trying to get 2022 appropriations done, which would keep the government open. And as part of that process, the Democratic majorities in both chambers of Congress and, of course, the White House are trying to get major social legislation passed. So that's a pretty rare brew going on of macro, huge aircraft carrier size issues trying to be resolved. So, it's kind of a mess on a macro level, not to keep saying macro, but it's a mess on a macro level. And that doesn't even get to talking about kidney issues, which kidney issues will get talked about this year. But there's all these other massive things that need to be resolved. To the extent that kidney issues are going to get resolved in 2021, I think it's going to be closer to the end of the year. Does that answer your question?
Yeah, no, that answers it perfectly. And actually, I think what it does is it gives great context for all who are engaged, experienced, and those who are first coming into this process of why communications and sorting out the kidney agenda on Capitol Hill is so important as we work as a coalition. Now, taking a look at some of the advances that have been made in telemedicine and the flexibilities extended to both doctors and patients to stay safe during COVID, can you talk about some of the legislation the two of us are working on in our respective organizations to make certain that those flexibilities and care choices that patients have can be solidified going beyond COVID, so people have the convenience of telemedicine? I know there's one that you guys are burning a lot of shoe leather and telephone calls on to make happen alongside us. You want to break that one down?
Sure. And, Paul, I think I'm going to move from the general to the specific here. First, it's baseline thing to know is that the public health emergency that's been in place since the spring of 2020 is still in place and not expected to go away anytime soon. So a lot of what we're talking about with telehealth is when the public health emergency ends. So we currently still are in the public health emergency. So all the telehealth flexibilities that were created a year and a half ago are still out there. Now, in terms of the bills that are out there, there's a whole lot of bills. It seems like, every legislator in Congress wanted to introduce their own telehealth bill, which of course is somewhat problematic. But the major ones that are emerging right now is that there's something called the CONNECT Act, and CONNECT is an acronym, and I couldn't give you what the letters stand for, but is essentially broadening use of telehealth in Medicare, and it really does the two big things, which is to remove the restrictions on originating sites, that is where the patient is when telehealth occurs, and geographic restrictions, which means it can only be done in rural areas as defined by CMS. And that's problematic because CMS's definition is really limited. So what it would do would allow the patient's home to be an originating site. So patients could do this from their home with their iPad, with their iPhone, whatever. Some of the bills also seek to make the dialysis facility an originating site. Not all of them. I mean, we support that, but it's not something we're going to the mat on. We think it's probably a good idea for patient convenience and for to open up another site, but it's not something that we feel super strongly about. So the CONNECT Act does that. The Cures bill, which is the Cures 2.0, I guess, that also has the originating site and geographic restriction pieces in it, but it also has a provision in there that would remove the requirement for a quarterly face-to-face visit between home dialysis patients and their nephrologists. And we are opposing that because RPA simply believes that patients should see their patients periodically. Quarterly sounds about right to us. And we think that removal of the requirement could affect how services are addressed by CMS in the future. So we oppose that. I think we have some confidence that a lot of other groups in the community agree with us on that, but those provisions are in a couple of the bills right now. So I think that's kind of the lay of the land on telehealth, but if you have more specific questions, I'm happy to answer them, Paul.
No, I mean, so in a general sense, there is the opportunity here to try to get these flexibilities in place, at least so that folks have access and the continued use post public emergency for telemedicine. But I'd say probably one of the shared concerns that we have, and we haven't looked at the specific language on this, is that if you are in a home care situation where you're doing home dialysis, you want to make certain that people have an opportunity to be seen by a nephrologist, because if you're doing home dialysis, whether it's hemo or PD, you can develop some issues. And I know that you folks on your board and the doctors that work with you, Rob, they are big advocates of home care, but they're also first and foremost advocates of making certain that patients have the best care available, meaning they want to see them, they want to know their patients, and they want to make certain they're not developing any other conditions. Is that a fair characterization?
Absolutely a fair characterization. Our docs say that there's just absolutely no replacement for having that face-to-face interaction, being able to see how the patient walks, being able to look at their access site, right in the moment, edema, that sort of thing. So no, there's no replacement for that. One other point I wanted to make a little more broadly, Paul, is one interesting thing that's going on with telehealth is that there's so much bipartisan agreement that they want to do something that it might be something of a detriment in moving forward swiftly, in that they think that they can pass it anytime they want to. So there's less urgency than for, like particularly the macro issues they have going on. But, for some other issues in healthcare, like prescription drug pricing, or I will also say more specific to physicians, if the status quo were to go in place right now, physicians in Medicare Part B would get close to a 10% payment reduction for 2022 between what they call sequestration and a formula-driven cut in the Medicare fee schedule reimbursement. So I think it's kind of a oxymoron that there's so much agreement it might not get moved on more swiftly, or maybe even until 2022, because they agree so much that they think they can pass it anytime they want to, which I think is a curious circumstance. I'm sure you've heard of that before, Paul.
I have, Rob, and actually, it's one of the reasons why we'll keep our members motivated and educated on these issues alongside with you and other organizations to make certain that the patient voice is strong at the table throughout, and that we can get these flexibilities in place post so that they're there post public emergency. One last thing, Rob. Any other issues that are floating around out there that our folks might want to know, other than how we can be helpful to you?
Well, again, for us, and for us in all of organized medicine, getting the getting Congress to do something about the physician reimbursement, just because if it goes down 10%, that's not good for anybody. And of course, as you know, we're working on this living organ donor bill. Sounds like, to the extent that there were some disagreements about the language, those have been resolved. It's the legislator's bill, but it's certainly something that we all care about. And we really appreciate the partnership with AAKP and want to make ourselves as useful as possible, to AAKP and the community in terms of moving that forward.
Well, we look forward to working with you on that, Rob, and other issues. And I tell you what, I know you're busy, and you've got a lot of events coming up for RPA and keeping your members in good shape and well informed. So I appreciate you taking the time out. It's always a pleasure. And for those of you who are watching, there's a reason why Rob Blaser won the AAKP President's Award several years ago. He's in the trenches. He looks out for your interests. And Rob is one of the folks that understands that the relationship between physicians and their patients, nephrologists and their patients, people like us, is critically important. We work together. We have a symbiotic relationship, and we are the most powerful on Capitol Hill when we're working side by side with the medical professionals. Although doctors don't always like it sometimes when the staff asks for patients to speak first. But Rob is going to be smoothing that over for us. So, Rob, we appreciate you taking the time.
Bravo, 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 Paul. I could not overstate how much respect I have for AAKP, and I really appreciate your partnership.
Thanks a lot, Rob, and say hello to Dale and all the crew over there. Thank you very much.
You got it. Yep.
Hey, Peggy, thank you so very much for joining us again for Under the Dome. This is our 5th year, as you know, and you were there at the first one, and we appreciate you taking the time to help educate our patients and viewers at our annual meeting. One of the things over the past 18 months, Peggy, and you and I have talked about this at length, is that COVID has created a ton of engagement because we're doing everything virtual. And now what we have is an entire new class of patients that are joining us in advocacy activities, not just through our annual meeting, but throughout the year. And one of the things that I think would be helpful is, with your expertise in Washington, both in Congress and in the executive branch, kind of laying out what it looks like to have a successful coalition effort on Capitol Hill across a kidney community, all the different organizations. What does that look like from your perspective?
Yeah, thank you, Paul, so much for having me. I love our chats. So I'd first like to say that the most important thing about an advocacy effort and working with other groups is trust and integrity. Working with each other along the lines of, we can communicate fully and completely and share what we believe about an issue and how we're going to convey that message to Capitol Hill is the most important thing that we do. That integrity that you bring with you to any kind of Hill visit or coalition effort is the lodestone, the linchpin of all of advocacy. And that may surprise some of you. Believe it or not, there's integrity in lobbying, but it is so incredibly important to walk into an office and say, we've thought about this, we understand where we're coming from, and we have a story to tell you, and we have an ask. We have a very specific ask of what we want you, member of Congress or member of the administration, to do. Here's how you can help us.
And Peggy, along that line, I think sometimes you make it look very easy. We can make it look easy sometimes as we're working on the Hill. But the preparation behind that, can you just, and I know I hadn't talked to you about this, but can you talk about the hours that are actually invested before we even make an ask or do something together as organizations?
Yeah, it's so important that you know your politics and your policy and the people you're talking to. There's a lot of P's involved in that, but think of them as the way that you communicate. So if you don't understand the politics of what's going on Capitol Hill in that moment, it's like talking to somebody you've never met before and just striking up an awkward conversation. You really need to know what they're facing what they're dealing with, if they've got other big issues happening at the same time, if they're in crunch time, you want to ask them questions. What are you working on? What is your boss's top priority in healthcare? Think of those questions as your way to have a conversation as opposed to just give a speech. You're definitely not just giving a speech. You're trying to engage and communicate with whomever you're talking to, whether it's the Hill or the administration. The prep work, it comes in many forms. It's we've read the legislation. That's the most important thing. We understand the issue. We have thought through the clinical implications. We have talked to patients, impacted families before we ever go to Capitol Hill. That's how you do lobbying well, is you know what you're talking about, you know who you're talking to, and you know how to engage that representative to help you do what you need to do.
The flip side of that, Peggy, in terms of what does the lack of success look like? What are the factors that go into a failure with the community?
It's ugly. I've seen some of it happen, and it really isn't pretty. It takes the form of people coming in and doing things like, well, I'm a constituent and you need to do this for me, and I put you in office. Whoa, really bad idea. Not a great conversation starter. It takes the form of a couple of people in a meeting and they're in disagreement about what they're doing together. And the Hill staffer just looks really confused. Like, did you guys not talk about this before you walked in the meeting? Those are two ways to do it very badly. Another way to do it very badly is to be antagonistic. You have to, you need to, you don't understand, you're not listening to me. Clearly, you're not going to have a productive conversation if you come in with an antagonistic bent. Other than that, the other worse meeting, which doesn't kind of feel worse, is the meeting where you got nothing out of it. You just spoke and you didn't ask them any questions. You didn't exchange any information. You didn't ask that person anything. You didn't get anything out of the meeting other than a blank stare from the Hill staffer because you just gave them a speech. You can avoid all of those things pretty easily by following the great advice of those who are coaching you before you go into those Hill visits. Hey, Paul, did I miss anything?
No, not at all. And I think it's important, especially for folks that a lot of our patients and family members have had the opportunity to actually walk the hallways with you personally, Peggy, and with the team from the American Society of Transplant Surgeons, and also with our allies at AST, the American Society of Transplantation. And we're a good team. We have over 10 years of experience personally together, and you guys have been fantastic Sherpas to our patients on transplant issues and other things where we collaborate on. But I think it was important for people to understand what success looks like and what the lack of success and the amount of work that actually goes into all of this. One of the issues that I also wanted to get your insights on for folks that are listening is I think a lot of attention, if you watch the news and that type of thing, everything seems to be focused on Congress and on Capitol Hill. And as a kidney community, it's important, I think, for people to understand, and especially with your background, and we spoke with Rob Blaser earlier, to understand that both sides of Pennsylvania Avenue, both ends of the avenue, Congress and the White House, impact kidney patients and transplant surgeons and the entire medical profession that cares for us across the spectrum of kidney disease. Can you talk about the importance of agencies like CMS and maybe a recent success that you've had bringing the community together to impact executive branch policy?
Right. Executive branch policy, as Paul knows all too well, is defining. Their role is not only defining of where Congress could eventually go, it also helps to give what we call TA, or technical assistance, to a bill that's being drafted. And also the regulations come out of the agency. So they're there at the start, they're there at the middle, and they're there at the implementation phase. So don't underestimate the importance of the agencies and just focus on Congress. The agencies are incredibly important. So in communicating with them, it's slightly different than the way you're communicating with a Hill staffer. The way you're communicating with CMS, for example, the Centers for Medicare and Medicaid Services, is usually at a higher level where you've written a set of comments, typically, and submitted the comments through a very formal process called notice and comment rulemaking. And recently, we had the opportunity to do this, and we do this a lot for our clients. For American Society of Transplant Surgeons, we've done it, 20, 30 times in the last couple of years. So we do this frequently, and we know how to do it. So, and recently we proved we know how to do it well. So there was a rule that came out of CMS, and it was in the context of what's called the inpatient rule, which is about hospitals. Well, where do you get transplants at a hospital? So the agency put out an idea, and the idea was relative to changing how transplant is financed. Well, they had a nifty idea and they threw it down on paper. And when we started chewing on it, we are transplant surgeons and the transplant administrators, and also patient groups, AAKP in particular, took a look at the rule and said, whoa, I don't think they meant to hurt living donation. I don't think they meant to hurt transplant, but they just did. So how do we approach them? And what we did was a multi-pronged strategy, including 500 comments to the agency that were submitted electronically. Also, multiple letters to Congress, from Congress to the agencies. So we orchestrated congressional input back up to the agency to say, hold on, guys, are you sure you meant to do that? We are the leaders in the transplant space. We know what we're talking about on living donation because we support those bills in Congress. Are you sure you want to go that way? So all of that, plus many conversations with many people, turned into a real rarity. The CMS took out that provision of the rule because we asked them to. Well, that doesn't seem that dramatic, but it's really dramatic. It doesn't happen that often, and it happened for all the right reasons. We got a bad idea taken out of play, and the part we inserted back in was, what we need from you is stakeholder input. You need to listen to us. You need to talk to us. We have clinical evidence. We also have patient experience that should be very valuable to you before you change the entire financing of transplant. Talk to us first. And that, I think, well, it was heard because they pulled it out of the rule. And now what do we do next? We do, I think, what AAKP, ASTS, and AST do really well is talk to each other, get our messages in line, and go back and communicate to the agency, okay, here's a better way. Here's a better way that's not going to hurt our ability to have more organ donation and move forward with getting more transplants.
I appreciate it, Peggy, because I think it's important that people understand that as much energy as we put in trying to pass good things, a well-organized and coordinated coalition is also very vital in stopping bad policy or policy that may not originate from bad intent, but it just was not informed when it was first being put together. And that's the valuable role of patients and doctors working closely together to have that unified approach to policy, to inform agencies that, hey, sometimes a great idea is not that great because it has implications for the healthcare system, for transplantation, and for patients. Along that line, Peggy, in terms of understanding terrain, and you have been a staunch advocate of this and extremely helpful to AAKP and to our patient members in understanding political intelligence in terms of how it's important to know the terrain that you're operating on Capitol Hill. In that regard, before we get into some of the issues that are moving around up there right now, can you tell us what is your sense, and based on your expertise, of the environment in Congress and the terrain upon which we're operating right now as we go forward on some of these issues?
Right. As the younger generation would say, it's a weird time. It is a very weird time. I'm in my living room and I have spent countless hours, like many of you have, on Zoom calls. I have done hundreds of Hill visits sitting here in my living room. And it took a while, for everybody to kind of understand what that looks like and what it feels like and how you can be more comfortable talking to Hill staffers in that way. They are under pressure. They are oftentimes very young. 22 kind of is the average age. And there's ways to approach them and talk to them that make them feel more comfortable. And some of them have already addressed, of asking them, so do you have any markups coming up? Or I noticed that the Energy and Commerce Committee is having a hearing on budget reconciliation tomorrow. Are you guys active in that? What are you working on? Ooh, that's really interesting. Sometimes you can play off of what their boss's interests are if you can think on your feet, and then you merge back into your own messaging and you talk about your own messaging. But have the respect enough for them and what they're doing to understand that you should have an understanding or try to have an understanding of the various conflicts that are coming at them. They are ridiculously busy people, and you think you've got a lot of email in your inbox. You have no idea. They have thousands of emails every day. So it's getting their attention is like getting the attention of a gnat with ADHD. It's tough, but you keep them focused, and you can get your message across. And if you have a specific ask, that makes all the difference. Don't just go in and tell your story. That is beautiful. That's lovely, but you have to tie it to what you need them to do for you.
Thanks, Peggy. And speaking of issues and opportunities, last year the community had a fantastic opportunity and a victory in terms of getting immunosuppressive drug coverage through in the Congress and signed by the president before his term ended. And we appreciate the collaboration across all of the community, all the organizations. This year, we're optimistic. You have the Living Donor Protection Act up on Capitol Hill. Our organizations, AAKP, AST, ASTS, and many others have worked very collaboratively on that to try to bring that home. We've worked on that issue for over 10 years. Can you give us a sense of how things are moving around on that?
Yeah, in our parlance, we call it the sausage making. It's something you really don't want to see, but when you get the sausage and it tastes really good, you go, wow, that was great. How'd you do that? It wasn't pretty. Working on both Immuno and Living Donor Protection Act, balancing all of the various interests of all the various stakeholders can be tough. And I don't always have it, but patience really matters in those conversations. It also really matters what the words say and what the words do. So the legal meaning of words, sometimes we fight over commas because commas matter. That's the backstory that is that difficult work to getting us to a place of consensus to move forward on issues. Also, the political process is, many people have different views about how the political process will work. We all prophesize that maybe this committee will act first, and maybe the Senate will do something before so-and-so else does something. We often differ in those views, that strategy, intelligence, we sometimes differ, and we talk it out. We talk it out like any good relationship or maybe even a good marriage and say, oh, I hear your point, but what about this? And what about this? And we're predicting things. So sometimes we're wrong. But if we throw ourselves fully into it, get as much intelligence as we can, we're bound to make the best decision together, as opposed to somebody who walks in and says, this is the only strategy and this is the only way it's going to work, and they don't listen to other people. That's a problem. You got to have the understanding, the buy-in, and the patience to listen to everybody else's strategic views and modify your thinking based on the best intelligence you have. Is that responsive, Paul?
Oh yeah, no, that's very helpful, Peggy. And in terms of Living Donor, our organizations took a look at that when it came out. We thought it was a very important first step. We know that the members have been very responsive in listening to patient concerns, and that's ongoing. And we sincerely appreciate that. And I think you folks would probably agree with that perspective, that the Hill's been very responsive in listening.
Well, let me put a finer point on that, if I could, is that AAKP is the reason that right now we have better language that will go forward on the Living Donor Protection Act. They were the drivers. They are the drivers. And we heard you loud and clear and stood behind you and stood beside you and had your back for all the right reasons, because the Living Donor Protection Act, by its very name, should be first and foremost protecting those living donors, so that those living donors have an ability to go get those insurances that they need. And it isn't unclear. It isn't a place where you say, well, it's just easier not to donate then because I might not get insurance. So that is our mission. That's our reason. We always go back to that touchstone and make sure whatever legislation we're working on is patient focused. Yes, I represent the transplant surgeons, but the transplant surgeons and I believe to our core, without the patients, we're nothing. I cannot do my job well if I'm not responsive and completely connected to patient organizations. And AAKP, I'll tell you, is the best in this world. And I love working with you all.
Peggy, we appreciate it very much. And the hours that you have taken and your team has taken up and down the hallways and educating our patients has been absolutely incredible and heartfelt, and we can tell. we understand, and we feel empathy when it's genuine. And you folks have had great empathy, all of your surgeons. Plus, they're a lot of fun to work with. Um,
Mhm.
as we could move forward here through the close of 2021 and into 2022, we have a couple of things going on. As you know, we register voters with our Kidney Voters program. It's nonpartisan. It's not for a particular candidate. It's basically telling patients, hey, you have a stake in the process, so register to vote and look at kidney issues and ask questions of your elected leaders. Are there other things that you think that patients can do throughout the year? The power of the patient voice just from their home, from their laptop, from their iPad. What's an ongoing relationship of a patient and an activist in the kidney world look like in regard to the Congress and with agencies? What would you recommend people do to stay engaged?
Yeah, I think build that relationship with that congressional staffer or staffers. So you've got two senators, no matter where you live, and you've got one representative. And those three people should be your very best friends. So find out who the legislative assistant is for health, and Paul or I could tell you that for each of those offices, and start talking to them. Now, don't send them an email every day. I've already told you how many emails they get in their inbox. Judiciously build that relationship. Talk to them when you need to talk to them, and also share with them intelligence you have. You see something in the newspaper, you see a really good study that just came out that made a point you're trying to make, shoot it over to them. Hey, I thought, in case you missed this, I thought you'd want to see this. This is what this study says and does. It amplifies my point that living donation is the most important thing in the world. I'm making that up. But a quick little email. Don't be writing these 3-page tomes. They're not going to read them. They're not going to read them. So communication with them is always, well, hopefully a two-way street if you do it right and do it carefully and judiciously. Think about it like that friend of yours from college who you're not in touch with every day, but they know you love you. They know you love them, right? Because you're giving them information and things that they could use over time. Um, Also, don't forget that you have district offices for each of those three members I just mentioned. So you don't have to be talking to the one here in Washington, D.C. You could be talking to the in district folks. They also have staff back at home. You could, well, COVID aside, you could go visit them. You could go invite them to, let's say you work at a facility that is, or a transplant center. For my transplant surgeons, we would invite that in-district staffer to go see a transplant. Again, probably not in COVID times, but those kind of interactions make a big difference, and communicating to the members at home matters. The other thing that matters, really the most of all, is don't forget to thank them. Thank them when they do something right, when they do something well, or even they just respond to something you've sent to them. Thank them. This is normal human interaction. If you're kind, if you're thankful to people, they're gonna be better to you. I shouldn't have to tell any of you that, but a lot of people do forget that the thank you is one of the most important elements of our job.
Peggy, that's actually putting a very fine point on something, because across AAKP, we have Richard Knight, who's a veteran of Capitol Hill, worked extensively on the Hill in much of his career with the Congressional Black Caucus, very bipartisan set of relationships he has. You have Ed Hickey on our team, who comes out of the executive branch and Capitol Hill as well, kind of programmed to think bipartisan in consensus. We have you and your expertise, Bill Applegate at AST. And so as we're working collaboratively, I think a lot of people think that the action happens only in Washington. But one of the points that you're making is, much like Tip O'Neill, the former Speaker of the House, would say, all politics is local. And do you think that on balance, having the expertise and voice in Washington, on balance, is it just as important to have that at that local level, and that's within the easy grasp of people?
Absolutely. You'd be surprised how much you can get done at home. Members of Congress eventually go home, and they're in the district, physically in the district, and that staff is very important. And when they hear about, I'm in Tuscaloosa, oh, really? That's where I grew up. Oh, where'd you go to high school? That's an easier way to form a relationship than somebody who's you never met before, right? So that hometown touch can be everything. And it's also, what if you got that member of Congress involved in, I'm making this up, the kidney walk? What if you asked them, hey, can you come walk with us? can you put out a statement saying you're supportive of our grassroots initiative? Something like that. Don't be afraid to ask them where you're doing something back at home in the district for their involvement. They relish that. They often really appreciate it. The other thing I'll tell you is that between Ed and Richard and Paul, you guys got the dream team. You have no idea. I mean, you probably know the years of experience that you've got with these folks and how the three of them work together. You're going to kill me for saying this, Paul, but like siblings. I had three older brothers, and these are like my three older brothers, and they banter back and forth, and one of them's hot, and one of them's on this, and one of them's on that, and they finally reach a consensus. It's a wonderful dream team, and don't tell my brothers I said that because they were less so.
Peggy, I tell you what, you're part of the family, and we appreciate it. And with all sincerity, we know personally that it takes doctors and patients working side by side, because that kind of raises the issue the best. And as I kid around sometimes with Rob Blaser and with others, sometimes when you're in the one-on-one meetings with Congress, they're interested in what the doctor has to say, but they often defer right off the bat to the patient and understanding that. And it's always good to see it. And you always share the laugh in the hallway afterwards and manage the egos accordingly. So hats off to you, because that's not an easy job.
I love it. I love it. We do have fun. I don't know if you guys can tell, but we have a lot of fun doing what we're doing, and I love doing it. And I'm proud to speak for transplant surgeons and to amplify the voices of the patients in all that we do.
Well, I tell you what, Peggy, thank you very much for taking the time out. We know you're busy, and you're always appreciated. And thanks again for joining Under the Dome. Thanks.
Excellent. Thanks, Paul.
I'd again like to thank Rob and Peggy for joining us for this session of Under the Dome. Kidney policy is not easy to impact, and it's certainly not easy to advocate during these times of COVID and remote technologies and trying to make connections with people. But both Rob and Peggy have been very staunch and loyal allies, not simply to the American Association of Kidney Patients, but to patients. They understand that for the equities that they represent here in Washington, D.C., with renal physicians and transplant surgeons, that their work depends on the patient consumer and patients having full choice in their care. They are very strong advocates of patients. They understand and they have tremendous empathy for people like us who have suffered through and are trying to make a difference for patients that have not yet been identified as living with kidney disease. They are very, very strong and empathetic people for our cause. I'd like to thank them again, both for taking the time out of their days. They are extremely busy professionals, but they never hesitate to help out the American Association of Kidney Patients. So thank you both.